Right, so we'll be in this laying position, where knees and hips bent, and then we're gonna let one leg go out, and we're coming up straight, keeping that core nice and engaged, and then also focusing on the hip flexor, so right in the front of the hip, we're trying to activate that muscle so that when we're walking, when we're having to do any kind of bending, twisting, we have good engagement from that muscle. And for this one, we can go 3 sets of 10 to 12, and we're doing both sides. We're gonna do 10 on one side and then 10 on the other. Yeah, keeping that core engaged. And we'll go again, one more. Okay, we're just engaging through the core. We're getting full extension through, or flexion through the shoulders, and then we're back up. So we don't wanna arch the back here. We wanna keep the arms nice and straight. Good, and then up. And all the way back. You can use a little lightweight or a band in between the hands to make it a little bit more challenging. And this one you can do 3 sets of 10 too. And then we're gonna be pressing up from that position, good, and then we're back down. And we're only gonna hold for about a 1 to 2 count. We don't need to be up there for too long. So let's press, 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 1, 2, and then we're down. And we're gonna do this exercise for 3 sets of 6, okay? So not too many. It's more about the endurance of those muscles. Good, and then we're down.
In the clinic type of treatment.
Okay.
Yeah, but I think for sure, like right now, at least we can approach the treatment as if it was a bit of a disc problem that's causing irritation to the glute muscle.
Okay.
All right? So I'm gonna show you about 4 or 5 exercises that will help your glute area, okay? Some of them you might be doing already.
Yeah.
Okay? So the exercise that we just finished earlier, the one where you cross your leg pulling up, that one's called the piriformis stretch. So the piriformis stretch is really good to really stretch out your glute muscle.
Okay.
All right?
Yeah.
But I think what's happening is you're not doing enough because you're only doing it every second or third day.
Yeah.
You actually should be doing, you do the stretches every day. It should be like at least, once a day.
Actually, Kevin, sorry, I walk every day and I do a stretch.
Well, I get it. Walking is great and it's a great exercise, but you still need to stretch it. Okay, there's a difference, right?
Mm-hmm. Yeah, I know.
So, a lot of patients, some of my patients say, well, carpenter, I'm on my feet 10 hours a day and I'm lifting lumber and all that. And I say, I understand that, but that's work-related movement. Flat on your stomach, and then I want you to just keeping your hips down. I want you to push up like this.
I tried that, but that is hard.
Does that hurt?
Yeah, it's hard. It hurts.
Okay, well, how about this position where you just lie down and you're just on your elbows like this? Can you try that?
Yeah, and I feel my.
I'm gonna put my right hand through it and then my left meets it to kind of support the thigh on the left side. Can you try that?
Yeah.
And then after you've done that, I want you to switch legs and then try it with the other leg and tell me how you feel. And also if it feels different in terms of hip flexibility.
Okay. Actually, this is one of my